When you're setting out to develop something, I think it's a good idea to know what it is your objective is that you're trying to develop for. And so what we did very early in the outbreak is we reached to one of the top modeling groups in the world right now for infectious disease, which is the laboratory group of Dr. Ira Langhini. Ira and his group did a lot of the modeling for the ring containment studies with Ebola that was successful in demonstrating the activity of that vaccine for that outbreak. So I asked Ira if he could do the calculations to determine how effective a drug would need to be if it was administered to a community or a household or a factory, small town. If a drug could be administered like a vaccine prophylactically, how effective would that drug have to be in order to reduce the reproduction rate, the infection efficiency of the virus, to below 1. What that means is an R0 of less than 1. If I get infected, if I have the drug and 70% of the people around me are also taking the drug, how effective would that drug need to be to make it so that the probability of me infecting somebody else is less than 1? If the reproduction coefficient drops below 1, then the epidemic is extinguished. So Ira was able to model this. And the answer is, depending on how efficiently the virus is transmitted, that's a function of mosquito density and population density and all kinds of different variables. But what he showed was that a drug only would need to be about between 20 and 50% effective if it's administered to 70% of the population for the whole range of reproduction coefficients that's seen with Zika up to an R0 of 6. We could, with a drug that's even partially effective, we can drop that below 1 and cause the outbreak to extinguish within a community.